Good afternoon, everyone. As you know, on September 30th, 2014, Mr. Duncan was the first person diagnosed with Ebola here in the United States. As we know, a lot of mistakes were made and a lot of fingers were pointed. We actually started our preparation for Ebola here at Rawlinsbrook 1 week prior to Mr. Duncan presenting at Texas Presbyterian. We had started collecting policies, scheduling meetings, but once we knew the threat was real, we bumped up our meetings and started our checklist for supplies. Our goal here at Rawlinsbrook is to be prepared in case we do have a patient present with Ebola symptoms. We want to protect our doctors and staff along with providing quality care to our patients. The purpose of this briefing today is to educate you, the staff, on what we're doing, and volunteers, on what we're doing to prepare for Ebola. You have pen and paper in front of you. I would like for you to take notes as we go, and at the end I'll have you write down 3 things that you feel are the most important things that you learned from this presentation and that you can take with you regarding Ebola. Ebola has been around, it's not new, it's been around since 1976. The bars indicate the number of patients who've been diagnosed with Ebola. Red indicates the death rates, blue is survival. It's in the hundreds. You can see it's not been very significant until 2014. And this slide is already outdated because we know that thousands of people have been diagnosed and subsequently died from Ebola. Where is it located? Primarily in Africa. You can see the continent of Africa here, and West Africa. Sierra Leone and Liberia are where the majority of cases have originated from. There are 5 species of Ebola. You can see the names along the bottom here. One important fact to know is that Zaire Ebola virus is the most deadly of these species, and that is the one that most of the folks are being diagnosed with now. So we are dealing with the deadliest of the species. So how do people get Ebola? It's believed that it's originated from the fruit bat. The bat eats fruit and drops pieces of it or remains of it on the ground. Animals then come along and eat the fruit that the bat has already put the disease in, and then humans eat the meat. And also, they're touching the organs here of the meat, and that's how it's contracted. So when patients get it, what do they present with? Early stages of symptoms include headache, muscle pain, sore throat, and fever. In the advanced stages, it proceeds to bleeding from the eyes, nose, and mouth, impaired liver and kidney, diarrhea, and vomiting. So what is our plan here at Rawlinsbrook? The most important thing is that we are screening every point of entry, screening our patients to determine if indeed they are at risk for having Ebola. You'll see at every point of entry we have these posters to remind for staff to read and remind themselves, and also for patients to see. The 2 most important questions that we can ask: have you traveled or been in contact with someone who has traveled to West Africa in the last 21 days? Or have you been in contact with a person with known or suspected Ebola virus? Those are the 2 most important questions we can ask our patients. If the answer to these questions is no, then the screening is done. We know that they're not at risk for having Ebola. If they do present with fever and one of the symptoms that we talked about, muscle aches, headache, vomiting, diarrhea, and they have these, and they answered yes to one or both of these questions, immediately we begin our action plan, which is number 1, to put a mask and gloves on yourself, and then provide the patient with masking gloves. All of the masking gloves are located at the point of entries by these signs. You would then call the nursing supervisor to let her know that we have a possible Ebola patient. She would transport our patient to room 201, which we designated on the the med-surg floor as the room that we will house these patients in, because it is a negative pressure room and because it has an ante-room or a little room inside the door where the staff can put on their equipment. We would then contact the CDC and the health department for further instructions. Our hope is that we would transfer these patients to a hospital that is more prepared to handle these cases, but in the event that that doesn't happen, we are prepared to take care of them here. We would have one-on-one, we would have minimal exposure to our nurses and one-on-one care for the patients. Another important thing is the donning and doffing of personal protective equipment. We have made it mandatory that any primary nurse who takes care of the patient will have a PAPR suit on, and then they'll have a buddy helping them get in and out of the suit. We've put CDLs on our computers. We also have videos on how to properly put that equipment on. We've contacted our waste removal service to make sure that they can remove any waste that we have. We do have rooms set up in the back of the hospital for the staff that are assigned to take care of the patient. We will house them here for 21 days to make sure that the disease is not spread to the community. Let's go on to the next one. Another important point to remember, in the hospitals that have already been through this, we know that the media swarms in and tries to ask any and everyone any question that they can get. It is important to remember that if they ask you a question, that you tell them, I cannot answer that question, but our public relations department can answer that for you, and direct them to public relations. That way we're all on the same page. They're going to try to get any little bit of information they can, positive or negative. They really want the negative stuff. So just keep yourself out of that and just refer them to the public relations department. The other important thing to remember, that we as healthcare personnel, we want to rush in and take care of a patient who's sick. We can't do that with Ebola. The most important thing that we can do is make sure that we have our equipment on and that we put it on properly. That might take 30 minutes. And some say, what would happen? The patient might die in that time. And that's unfortunate, but that might happen. We have to look at the greater good at that time. And at that point, it's making sure that we have our protective equipment on properly before going in to try to reduce the spread of Ebola. Any questions that I can answer for you? Okay, so you'll take a moment and jot down the 3 most important things that you learned from this presentation. Reflect on what you can take away and educate others on Ebola. Pam, I'll begin with you.
I think it's interesting that there's 5 strains of Ebola and that we are dealing with the deadliest, so we all need to be prepared. We talked about screening at each point of entry, which I think is good, and making sure everybody knows the appropriate questions to ask, and those are posted. And then the last thing, I guess, is that we are not going to be responsible for answering any questions, because there's already talk in a small town anyway, so we can send people to public relations for that.
Perfect. Rosa?
The importance of donning your PPE, to just be cautious and have no contact with them. I also, like she noted there's 5 strains of Ebola and we're dealing with the deadliest. And the last thing would be to not answer questions with the media, just to stay away from them.
Okay. Big Arm?
Self-protection, I think that's really great, which extends to families. I appreciate the information that the staff has got together for the other staff, the knowledge. I think that's all I have to say.
Okay. Thank you for being here today.